Teen Screen is a program that claims to have the capacity to reduce suicide in children in this country, and the means by which children who are suicidal can be identified and treated. Those are the claims. The claims are totally unsupported by science, and in fact contradicted by science and by a review of statistics through the years. Teen Screen is peopled with administrators and workers with deep and long-standing ties to the pharmaceutical industry. Dr. Schaffer is responsible for the creation of the survey instruments used by Teen Screen. He is and has been consultant to many pharmaceutical companies and has been very active in groups such as the American College of Psychopharmacology and other front groups heavily supported by the pharmaceutical industry. I absolutely believe that the survey for Teen Screen was intentionally structured to flag as many children as possible as having a possible mental health problem. Teen Screen is a dragnet for the pharmaceutical industry. Simply put, it is a means of recruitment. I believe its cold-blooded and cold-hearted intent is to recruit more children into the very subjective diagnoses of mental illness and to treat those kids with medication. I mean, how can somebody diagnose a child who has been maybe dumped by his girlfriend, had shy in front of people, doesn't like to talk in front of large crowds? How can you diagnose that person as having social anxiety disorder? In the state of Indiana, a young lady, Chelsea Rhodes, came home from school announcing that she had obsessive compulsive disorder and social phobia, or social anxiety disorder. Her parents were stunned, dumbfounded. They didn't know that Teen Screen was going to screen their child. They had not been asked permission. She received the obsessive compulsive tag because she indicated that she liked to clean her room. She received the flag for anxiety disorder because she said she would prefer to stay home and watch a movie than go out with her friends. She did not like to party a lot. And this is, again, registered in a lawsuit that is a public document because the Rutherford Institute took up her case and has sued the school district for administering this exam to their child, attempting to label their child with 2 bogus mental health conditions on the basis of very subjective questions to which she responded in a way that any normal child might respond. Given the state of affairs in this country and given the nature of the poor science involved in screening of children, and given the extent to which the pharmaceutical industry can gain from a false diagnosis, my advice to any parent, my advice to my children regarding their children, do not permit your child to be screened.